Want to really talk about, you know, cannabidiol, CBD, and cancer because I think it's the future of medicine. It's a future that's available now. We'll talk about some of the ways that that is evident in our practice. But really, it's about following the principles of innovation, elevation, and empowerment. These are the strategies that I embody, that we embody, to actually bring a legacy of support to integrative medicine, because I really believe that integrative medicine is the future of medicine. That word integrative, it literally is a Latin word, integrationum, that means to restore, remake, or renew the whole. So that's what we as physicians do. So I think that cannabidiol, CBD, in cancer, and honestly beyond, really fits into that principle. So to talk about CBD, cannabidiol, we have to first talk about endocannabinoids. The endocannabinoid system, it plays a dual role when you look at cancer in the regulation of tumor generation, so in the carcinogenesis or tumor genesis process, as well as the progression and metastatic process. So it plays an intimate role in cancer, both from the beginning and really the progression to the end. So what is the endocannabinoid system? I mean, when you really look at the framework and the structure and the origin of it, it was really only about the 1990s when this really became known as an entity. But it's a widespread neuroimmunomodulatory system. Also understand it has metabolic effects. It has mitochondrial effects. Its effects are broad spectrum. We'll see a slide in here in a second that shows that. And they play a role central in the nervous system, almost in the synaptic plasticity. So very similar to neurotransmitters, but they work differently. I'll highlight that just a second. Really important in how we adapt to our environment. And of course, it involves cannabinoid receptors, endogenous cannabinoids, which we'll talk about in a second. And of course, things like phytocannabinoids play a role in that process as well. And when you look at the endocannabinoid system, what you're really looking at here is it's everywhere. But its signaling pathway is different than the way we normally think of as it relates to neurotransmitters. It's a retrograde signaling process. So when you look at the endogenous endocannabinoids, AE, anandamide, and 2-AG, these are actually produced in the postsynaptic neurons. So they're produced on the end signal mechanism, and this then goes back to the presynaptic. And so it's retrograde, which is very different than the way dopamine, serotonin, norepinephrine, epinephrine work, these neurotransmitters, and actually has a signal back on the presynapsis, and this actually affects neurotransmitter release. So it's a retrograde signaling system that really permeates all aspects of the body and really all aspects of the metabolics, the immune system, the neurologic function, again, how the body interacts with the environment. Again, it was first discovered or as named as an entity in the 1990s. Involves three mechanisms. Again, what we're talking about here is the endocannabinoids, anandamide, and 2-AG. Involves the receptors, and also it involves the metabolism. So here we're talking about the fatty acid amide hydrolase. We're talking about the monoacyl glycerol lipase. So it's not just enough to talk about the signal going retrograde across the synapses. And this is a little bit in the weeds, I know, but it's important to understand, I think, just a little bit about this process before we jump into actually cannabis and CBD. But it's the signal with the receptor or receptors and how the metabolism there affects those receptors signaling. Talk a lot about hormone metabolites. Everybody focuses on simple hormones as women are an estrogen hot flashing and men are a testosterone-fueled erection. If only it were that simple. But the metabolism of the hormones here, the metabolism of the endocannabinoids are just as important as are the parent cannabinoids here, endocannabinoids as well. And again, as I mentioned, the reach is broad. And this is just a slide from a 2018 article that really just focuses on just a few aspects of what the cannabinoid receptors of the endocannabinoid system, their reach. And we're talking about brain. That's primarily CB1. We're talking about liver, reproductive system. So if you want to talk about the adaptation of the environment, of the body to the environment, that impacts the reproductive system, cardiovascular system, musculoskeletal performance, GI tract, pain, of course, and many other aspects. But what's interesting here in this slide is they leave off the immune system. And CBD2 receptors are predominantly expressed on the immune cell. And again, when you look at cancer, the answer to cancer is never get it, but beyond that, the answer to cancer is the immune system. So it's interesting that this slide from this 2018 article left out immune system and immune system cells, because that's probably one of the predominant effects of CBD endocannabinoid signaling through CB2 receptors. So history. My daughter has a master's in history and communication, so I always find it very important to understand where we've come from, because it helps us to know where we're going. Great quote, I use this a lot, from Steve Jobs: you can't connect the dots looking forward, you can only connect them looking backwards. Basically what Steve Jobs is saying here is we got to know our history. History is going to direct us to the present and direct us to the future. So let's go through this, because when you look at the history of cannabis, it's really interesting, because it's a journey through history itself. It's really, they're very much in parallel. So looking at paleobotanical studies, they found evidence of almost 12,000 years ago in Central Asia, near a particular mountain range, where they found evidence botanically and via paleontological studies. They found evidence of the cannabis plant. Some of the earliest records of the medicinal use of cannabis is from an ancient Chinese text called The Curious Virtue of Plants. And there's a Chinese surgeon who actually documented performing surgery via what he called anesthesia, or what was referred to as anesthesia, through the mixture of wine and herbal extracts, of which speculation is maybe some of those herbal extracts were in fact cannabis. Now we'll talk about what the difference between cannabis and cannabidiol, which is CBD, is in a second. So topical applications of cannabis for inflammation. I think we all know that well as it relates to chronic disease of aging, and here particularly cancer. This was in the Ebers Papyrus going back to 1500 BC. A very likely reference in the Homer's Odyssey text to cannabis. Herodotus referenced this back in, again, roughly 400 BC. A publication, the Naturalis Historia, from author Pliny the Elder, in the Roman Empire in early 1st century AD. The De Materia Medica by Greek physician in the, again, a little bit later, but 40 to 90 AD. Fast forward quite a bit here, about 1,000 years, Compendium on Simple Medicaments and Foods. This was looking at describing medical cannabis in the medicinal and in food form. William Brooke O'Shaughnessy was actually an Irish physician, published observations on cannabis all the way back in 1838. So you can see we're going our way all the way through history. Shout out to my son-in-law and daughter in northern UK. Queen Victoria took cannabis for painful menstrues. And of course, the Victorian era was 1837 to 1901. Yes, my daughter, I do know my history, at least per Google. J. Russell Reynolds in 1890 published 30 years of experience. Very prominent journal here, the journal Lancet. So again, we start to get into mainstream, but here we're talking 133 years ago. Interesting, CBD or cannabidiol was first isolated from marijuana, that's cannabis, in 1940. So when you look at CBD, cannabidiol, it is a phytocannabinoid. It can come from cannabis, which we all know as marijuana, but it can also come from hemp. So it really can come from two different isolates here, or isolate sources. But CBD was actually first isolated in 1940. But what's interesting is it didn't get people high, so they lost interest in it. Go figure. And it was also about that same time in 1937 that there was a marijuana without the J but with the H tax in 1937 that really in the United States propagated the cascade effect of how marijuana eventually made itself to a substance that nobody legally could obtain. In 1964, THC was identified via researchers in Israel. And so you can see when you look at cannabis, it is as old as history itself. It's not anything new. It's not anything just defined by the marijuana tax or the DEA restrictions. It's as old as time. And so when people focus on natural, holistic, and integrative strategies, it's hard for me to understand how people leave out cannabis, leave out CBD. I think a lot of it is because they get confused, and we'll touch on that in a second. But we need to dispel the myths associated with this because it has intense medical value. When you look at cannabinoids, we have really three broad types. We have the endocannabinoids, which I've already briefly touched on them as a part of the endocannabinoid system. That's anandamide and 2-AG. Phytocannabinoids is what we're talking about as it relates to medical cannabis, which a phytocannabinoid within medical cannabis is CBD. Others well known you may have heard of, which is THC. There's delta-9 tetrahydrocannabinoid. There's also delta-8, which comes from hemp. So phytocannabinoids are those that come from plants. There are also synthetic cannabinoids that are actually used and created via chemical synthesis. And these are a concern because they're being used in the community to really get people high. And they have a lot of residual effects that are not good. And you may know these as spice or K2. So many different types of cannabinoids in general, but what we're going to focus specifically is on phytocannabinoids, specifically CBD as a phytocannabinoid within the endocannabinoid system. So when you look at cannabis, which again, CBD was isolated from marijuana in 1940, there's over 540 secondary metabolites within the plant cannabis. There's over 120 phytocannabinoids, of which CBD is one, of which THC is a second. There are 11 classes that they categorize them into, and then there's the whole addition of the 200 plus terpenes that really can modulate the effects of these phytocannabinoids within the endocannabinoid system. Other aspects within cannabis include phenols, steroids, polysaccharides, coumarins, glycosides, flavonoids, alcohols, and many other plant nutrients. And so when we look at this, and this really applies a lot to the cannabinoids in general when we're talking about isolates versus broad versus whole in terms of delivery of the process to the patient, we're talking about the entourage effect. It's the cooperative effect between the many different components of the plant and how this applies to the therapeutic effect. And this broad, all the different pieces of the puzzle together really bring this entourage effect to the front that really provides the powerful effect that we know with the medical use of cannabis. And here again, CBD is one isolate. What I would say it's the entourage effect is like talking about a football team. You have 11 players, and the entourage effect is all 11 of them working together to provide the best result. In the same way, I call this in a way precision therapy stacking, which is bringing together the best, stacking them together to maximize or hear the entourage effect. Many different types of phytocannabinoids. Some of these, again, you've probably heard of. Just want to touch on them because I think it's important to dispel a lot of misunderstandings here. THC, tetrahydrocannabinoid, of which there is two types. There is a delta-9, which is derived from, again, cannabis, delta-8 from hemp, THCA, THCV, THCP, and then there's CBD, cannabidiol. You can see CBN, cannabinol, very helpful in sleep, CBG, cannabigerol, and CBC. So there's many different, again, over 120 different phytocannabinoids that interact within the phytocannabinoid system. So let's talk and start to get in a little bit to what's the benefit in cancer. interesting quote here. Looking at cannabis specifically target tumor cells, but has low potency towards non-cancer cells. So this is what I call the Trinity effect, and really it's emblematic of natural therapy. So what I mean by that is natural therapies seem to target abnormal cells and abnormal environments, but they don't hurt the healthy environments. You see this same kind of Trinity effect in vitamin C, in curcumin, in photodynamic therapy. So here the authors are saying, interestingly enough, that cannabis targets the tumor cells, but yeah, it lacks the potency to target and hurt non-cancer cells. Again, there's the research, we follow the evidence. And when you look at the Trinity effect, what we're talking about here, again, you're going to see this, and this is really characteristic of natural therapies, of holistic therapies. Conventional therapies come in like a sledgehammer to just shut something completely down. Not to say that that's not beneficial. It's just if we're working to restore homeostasis, if we're working to heal, we want to reach a healing perspective, and that's really achieved through homeostasis. So this Trinity effect targets abnormal cells and environments, and again, CBD does this, THC does this, vitamin C does this, curcumin does this, photodynamic therapy does this. It's very characteristic of these natural therapies, but it also protects and has minimal impact in a negative way on healthy cells or healthy environments. But more than that, it heals the healthy cells and healthy environments. So beyond the phytocannabinoids here, we're talking about the receptors. So phytocannabinoids, if you will, they're the knock on the door, and the receptors are the doorway to open up. And this is really important because it applies specifically as it relates to cancer. So we're talking about many different receptors that the phytocannabinoids can interact with. So CBD1 and CBD2, again, are your most prevalent and well known. Again, CBD1 most heavily expressed on the central nervous system, and CBD2 in the immune system. But I think what's important to recognize about these is research has clearly shown that these CBD1, CBD2 receptors and the TRPV, which is the transient receptor protein valenoid receptors, these are upregulated in a wide variety of cancer types: skin, prostate, colon cancer, hepatocellular carcinoma, sarcomas, glioblastomas, so lymphomas. These receptors are upregulated in cancer. This is a great quote from this study below. The expression of the CBD receptors and the enzymes involved in the endocannabinoid metabolism is often associated with the aggressiveness of the cancer. This suggests that increases in the endocannabinoid system may play a significant role in carcinogenesis. And so when you come in then with treatment with the CBD or other phytocannabinoids, you can actually counter this mechanism of which the cancer is working to do to favor itself at the detriment of the body. Another interesting point about the CBR or CBD2 receptor is it's a major regulator of the HER2 oncogene, and many people with breast cancer will know this all too well, but this applies to other cancer types. HER2 is a upregulated expression on breast cancer or in other cancer types that is associated with increased aggressive behavior, and of course it's targeted with many well-known drugs that are available today. But here the CBD2 receptor is intimately involved in the expression, the control of expression of that. Notice, interesting, it also interacts with the opioid receptors and serotonin receptors. And again, those TRPV, the transient receptor potential voltage vanadium channels, they are important in how CBD will promote oxidative stress in the cancer cells. Again, upregulated, the non-cancer cells not upregulated as much. It promotes cell cycle rest and promotes apoptosis. This is programmed cell death. So not only do we understand what cancer is doing with these receptors, we're understanding the mechanisms of how targeted activity with things like CBD can actually target the destruction of the cancer cells, but not hurt the healthy cells. So this is important because what's in a claim? I mean, there's a lot of information. People say we can't make a claim. Well, evidence can describe what's present. And so what we choose to do is we choose to follow the evidence. And so what you'll see in these presentations is evidence, is studies that describe and show what we're talking about. So we let the studies speak for us. And then, of course, at the end of the lecture, there will be a text where you can link to an AI-based platform where you can see the studies and interact there. So the word claim comes from an old French word claimer, to call, to name, to describe, or to proclaim. So what we want to do is make a claim as supported by the evidence, but it's the evidence that makes the claim. It's not us. We're just saying, here's the evidence, so that's what we're going to do. Versus there can be claims that lack evidence. So if you follow the evidence makes the claim. We're just simply following the evidence, and that's what a good practitioner of integrative medicine following the science does. So when you look at the broad effects of CBD, you can see it's not just related to cancer, and that's the beauty of this. And honestly, that's the application of CBD, again, coming from cannabis or coming from hemp. Pain control, that's analgesia, nausea, vomiting, anti-anxiety, antidepressant, antipsychotic, anticonvulsant, anti-asthmatic, inflammation, immunomodulatory. So it really affects the immune system within the tumor microenvironment to really downregulate and remove the immune suppression that is so prominent in immune evasion. Antioxidant, anti-inflammatory, antibacterial, add antiviral to that as well, neuroprotective. It improves the blood-brain barrier, integrity, permeability. And I think when we're talking about athletics, the impact of CBD on potential traumatic brain injury from concussions, I think why nobody's looking at this is beyond the scope, because it's been shown to reduce cerebral edema in stroke patients. And then, of course, anti-cancer. So again, pivoting from the endocannabinoid system, from just general cannabis to really focusing in on cannabidiol or CBD. A quote here from a 2016 article: CBD exerts a significant anti-cancer effect, specifically the inhibition of invasiveness and metastasis in different animal models of cancer. So we're talking here about how CBD, quote, from the evidence, again, we're not making the claim, this is what the evidence is stating. They're saying, hey, CBD, it has a very targeted cancer effect. More so, we understand that it's stopping the invasive process of cancer, and it's stopping the metastatic spread. Of course, here they were talking about animal models. And you can see they always show the mechanisms of action, and I think that's important in the understanding, but also in support of the evidence. So when you look at CBD and what evidence has shown is helpful in the particular cancer types, glioblastomas, prostate cancer, breast cancer, lung cancer, pancreatic cancer, colorectal cancer, melanoma, leukemia, lymphoma. And so when we look at the cancers that are really increasing post-pandemic, prostate, breast, glioblastoma, pancreatic, colorectal, melanoma. So it really is, I believe, a therapy of the future that's needed today. And thank goodness for the people at Pico IV, it is. CBD anti-cancer effects, so looking at it in a broad perspective here. And this is just the broad mechanisms of action of what CBD is doing to actually inhibit the cancer generation process as well as the cancer spread process. So you can see this here for yourself. It stimulates programmed cell death. It blocks growth, cell cycle arrest. It inhibits the attraction of cells to the tumor microenvironment to promote its growth. Cell migration, which is very important in how cancer spread, what's called epithelial to mesenchymal transition. It's actually anti-angiogenic, so it works beautifully with other anti-angiogenic therapies. Insert low-dose metronomic chemo, where the combination there would be powerful. Inhibits metastasis. Not any better therapy there. Increases reactive oxygenation species. This is oxidative stress that promotes its death. It depletes glutathione in cancer cells. It improves chemosensitivity. So here's particular chemo agents: Gemzar, cisplatin, doxorubicin, docetaxel. So we're understanding that, hey, if you have some chemo resistance, guess what? It'll actually restore it, improve sensitivity. Immunomodulatory. So get this quote. This is from an article. saying CBD binds CBD1 and 2 receptors in the infiltration of inflammatory cells, and it disrupts the pro-tumorigenic cytokine production pathway, leading to ineffective immune suppression and promotion of tumor cell death. What they're saying here is that CBD is actually negatively impacting the recruitment of immune cells to the tumor microenvironment, such as tumor-associated macrophages, tumor-associated neutrophils, and this in turn is leading to a reduction of immunosuppression within the tumor microenvironment that is so critical to how cancer evades the immune system and spreads. It inhibits cancer stem cells. It actually protects against other effects associated with conventional treatment, radioprotective, kidney protective, neuroprotective. So here we're talking about some of the chemo agents, and I think that also ties into the traumatic brain injury, and heart protective, so particularly when you're looking at chemo agents like doxorubicin. But most important when we're talking about the treatment of cancer, here this quote's talking about the many different mechanisms, both in vitro and in vivo, of what the effects are of CBD. One that stands out is increased survival. I mean, that's what this is all about. So this is a 2020 article, Cannabidiol is a promising anti-cancer drug. It's great to show, inducing cancer cell death, inhibiting cell migration, invasion. That's awesome. But if it doesn't increase overall survival, what are we talking about? And here, the article is showing, hey, we're seeing improvement in survival in the in vivo studies, of course. So it's not just the broad, it's not just the 30,000 foot perspective here that we recognize that the research is clear on in showing us what CBD's anti-cancer effect is. And again, that's beyond the broad effects, because I think you could just use CBD, IV or oral, in the treatment of pain, in the treatment of depression, in the treatment of anxiety. So that the effects there and the potential impact, I think, is enormous and as big as we want it to be. But here we're looking at the specific mechanisms of action of what CBD is actually doing. So here we're getting into the very, very deep weeds. So Miles, if you're watching, man, we're walking through the weeds here, my friend. So here we're understanding not just the broad what, but we're down at the 3-foot perspective. And we're understanding that this is inhibiting tumor-associated macrophages, tumor-associated neutrophil recruitment to the tumor microenvironment. It's inhibiting what's called netosis, neutrophil extracellular traps, that are really prominent in how cancer spreads metastatically. We know it actually inhibits total macrophage activity. It inhibits macrophage type 2 polarization, which is really important in how the immune system becomes dysfunctional. Get this. So for a lot of people with breast cancer and other types of hormonal sensitive cancer, it decreases aromatase activity. It's an aromatase inhibitor, CBD. It downregulates ER alpha. So when we talk about breast cancer and estrogen receptor positive, CBD downregulates estrogen receptors. When you have a patient or a person that has a breast cancer biopsy that shows ER positive, that is ER alpha. That is the form of that receptor. So here, CBD downregulates it. That's good, because estrogen can signal that, and here you're downregulating that. But more, it increases estrogen receptor beta. A lot of literature supports, when you look at prostate cancer, for example, that the loss of ER beta, which is a counter-regulatory signal mechanism to block ER alpha, is lost. So here it upregulates it. Again, I always like to show slides to talk about the evidence. I love this article. I encourage you to read it. Biomed Pharmacotherapy, 2023. Disorders of Cancer Metabolism, the Therapeutic Potentials of Cannabinoids. And again, we're going to focus on CBD. And I think this is interesting because here we're bridging together cannabinoids and metabolomics. Thomas Seyfried did this earlier, talking about cancer as a metabolic disease. It's another book I encourage you to read. And then, of course, a good friend of mine, Naisha Winters, in her book, The Metabolic Approach to Cancer. So here now we get the same concept of metabolomics making its way in the field collectively of multiomics into cannabinoids, and here specifically CBD. So when we look at the mechanism of cannabinoids, in the disorders of cancer metabolism. Here, it's showing how it increases the reactive oxygenation species or oxidative stress. Here's the specific signals. We must get in the weeds. We must know the mechanisms of action to be able to support what is being done. And again, this is the evidence, not making a claim. This is from the article there, and it's supported in many other articles. It also impacts here mitogen activated protein kinase pathways, very important signaling, cell signaling involved in cancer, instrumental in cancer, RAF, MEK, ERK, many others involved here as well. JUNK, that's a J and K. So it's involved in downregulating and blocking those receptors. Here it's affecting P13K, AKT. So again, this is a very, very important upregulated pathway in cancer. Again, I can, all the lines and everything involved there, it's for us nerds, but it's showing us the specific mechanisms of action here. We're not just theorizing. We're not throwing a dart on the wall and hoping it sticks. We are nailing the bullseye. And so P13K AKT is a very important pathway that our normal cells and tissue use. If you lift weights, as I do, you're stimulating this pathway by breaking muscle down and building it back stronger. What we have here is an upregulated, unregulated P13K AKT that cancer misuses for its benefit and the body's detriment. Here, CBD counterregulates that cell metabolism pathway. Here is a gain of function. I know that's probably a trio of words that gives everybody PTSD because of the last 3 to 4 years. But here, P53 is one of the primary tumor suppressor genes that gets turned off. It's estimated that 60 to 70%, around 62% of all cancers have a P53 mutation, which is a tumor suppressor gene that gets turned off. So it's a loss of function. Here, CBD employs a gain of function activity, upregulating the P53 gene, upregulating the P53 protein through transcription translation. That in turn acts as a tumor suppressor gene, which does exactly what its name applies. It suppresses abnormal growth. Here it's actually regulating the metabolism via hypoxia-inducible factor 1 alpha. When people talk about hypoxia in cancer, they're talking about how this promotes angiogenesis, which is the blood vessel supply growth, which promulgates how cancer spreads. And this is very important in immune modulation that the cancer uses for its benefit. And it's all through this signaling of hypoxia-inducible factor 1 alpha. And this is also involved in causing the metabolic shift in cancer. But here, CBD is going to the target of this major metabolic shift that Thomas Seyfried described, that Naisha Winter described, and others. But CBD, the cannabinoid from medical cannabis, or from hemp, is specifically targeting this mechanism. And then just bring it all together and you just have a beautiful, just picture of everything of what CBD is doing in the different mechanisms or metabolism of cancer. So it's a beautiful picture. It's the evidence. It's not a claim. That's just what it's showing that it's doing. More, same article, cannabinoids have been shown to regulate enzymes and signaling pathways associated with metabolic reprogramming in cancer. So we need to rethink how we approach cancer. We approach cancer as going to war. And where has that gotten us? Sure, there's been some advances, but we have more cases of cancer today than ever before. It's the #1 cause of mortality in adults. That's what the prospective urban rural epidemiology study shows. So we need to focus on reprogramming. And this is the beauty of natural, holistic, and integrative strategies. They work to reprogram. They don't work to destroy, but they work to reprogram and salvage, restore, renew, remake. So it really fits within the integrative strategy. And here we're seeing the mechanisms of how it does it. Now the problem is really multifactorial in why CBD and I think medical cannabis hasn't gotten a stronger hold in medicine. I think that's changing, but of course there's great resistance. But fortunately, the patients are the tip of the spear and they're forcing the change. It's just medicine is reluctant to come along. So just keep that tip of the spear focus and that will happen. And the reason why there's problems, there's a multitude of them, is there's cannabinoid confusion. We'll go through each one of these. Dependent, different environments, systemic delivery for systemic disease, pharmacokinetics, pharmacodynamics, and bioavailability. And understand, this is why we're going to get into the mechanisms of why IV is so important here. Cannabinoid confusion. Not really sure medicine understands the difference just as much as the general public doesn't understand the difference, and I would point politics right in there. I don't think they have the first clue. And I think a lot of this goes back to that, marijuana tax in 1937, and how that then propagated, cannabis into the drug category, and how that has then, I think, permeated our culture, and it's biased us when we think about this. And I think this has slowed the innovation of cannabinoids in the medicinal use today, and hopefully it won't, but I think it's going to slow its future progress as well. And when we talk about cannabinoid confusion here, particularly I'm talking about CBD, it's not THC, it's not tetrahydrocannabinoid. So tetrahydrocannabinoid, or THC, that's the part that gets you high. CBD doesn't. And in fact, you look down at the bottom, you can actually use it as an antidote if somebody takes too much THC. It actually counters the psychoactivity of THC. It's not psychoactive. Yet, when you combine it with THC in particular ratios, you get synergistic effect. And here it's been shown to actually augment chemotherapy effect, whether that be restore sensitivity or improve sensitivity in general. So I think when people look at cannabinoids or CBD of a cannabinoid, they think it's THC, and that's just clearly not the case. And I think the states and the politicians don't understand that, and that's what propagates a lot of confusion. And so again, high dose CBD will actually be used and can be used to counter the psychoactivity of THC. This is why the ratios and why I prefer a high dose CBD to THC ratio, but clearly I think there's some benefits where there can be 1-to-1 THC CBD, but it's all about dosing, it's all about delivery. So when we look at the dependent problem here, it's because of the cancer types, the concentration of the cannabinoids delivered. This applies to so many different therapies. I mean, this applies to conventional therapy. If you have high blood pressure, doc gives you a blood pressure medicine, and it's not the right dose, guess what? You're going to have to go up on the dose. The same process and logic applies here in natural and holistic therapies. And of course, cannabinoid preparation plays a role, whether that's isolates, broad, or full. And then also the receptor or receptors expression in the targets, because it's not just that there's a CBD1 or a CBD2 receptor. We know that the transient receptor protein vanillinoid channel receptors are interacting with CBD1 and CBD2. So we know these receptors are actually, they're working together or working in the expression affecting each other. So this is not just an isolate sequential process. We have to think of this almost on a quantum physics level. It's just much bigger than what we're trained to think on. So different environments. This is part of the problem too. When we look at cancer, people think, well, the whole body's cancer. No. We have environments within the body that are abnormal, that are dysfunctional, that's cancer, and we have normal, healthy environments. So if we're stimulating the immune system, that can help the healthy and the abnormal environment. So the different environment dictates different effects. So when we target cancer cells, this goes back to the Trinity effect, we are targeting very specifically abnormal environments. This is why when you give IV CBD, you're going to feel it in points of inflammation. This is why when patients have cancer and we give them low-dose metronomic chemo or vitamin C or local hyperthermia, they feel it in that point of direct inflammation, the cancer. And so you're going to see that outside of that as well. And more importantly is the tumor microenvironment, which is our evolution of understanding of what's really going on in cancer. It's not a solid ball of cells isolated from the body, but is in fact an environment whereby the healthy environment is interacting with the abnormal. And so the obvious is we have a systemic process. We must, that is cancer, we must treat it via systemic delivery. I mean, I know that seems That seems obvious and seems straightforward, but when we look at cancer, people think there's a sequential progression of it in that it's present, then it invades, then it grows as it invades, then it starts to systemically spread. It's all happening at once. So when you look at the research on cancer, our understanding again is changing with the tumor microenvironment understanding is when cancer is present, when it's invading, it's systemic day one. It's systemic from the get-go. We got to get through and get out of our mind this sequential process. So here we are headed into the Halloween and actually into Christmas, and we're talking about The Nightmare Before Christmas, the movie there. So we're talking about some fundamentals because we're going to get into some nightmares here. Because the way I think of it is back when I was in medical school the first year, one of my courses was pharmacology. And so there, it was really interesting. I think they did this on purpose, where we would walk down to the pharmacology office, and they would have the scores of our test listed on a piece of paper. This is back when they did it on paper, and they put it on the door. And so we walked down this long dark hall. I mean, it was like we were, it's like that picture shows. It's the fear, it's the apprehension, but it's all about the fundamentals. So we'd walk down there, we see our scores, and it's like, I'll just get this through and I'll be done with it. What is pharmacology going to have to do with me being a doctor? Well, these fundamentals, though they were horrors then, they're applicable by far now. And some of them that are clearly applicable here, and this is why the IV is so important, is things like pharmacokinetics, which is the study of the time course of drug absorption, distribution, metabolism, and excretion. This gets down to the bare bones of why therapies work and why and what is the best way to deliver therapy to make it work. Pharmacodynamics is looking at the relationship between the drug concentration at the site of action and its effect, looking at it as it relates to levels, course, and intensity of therapy, therapeutic effects, and adverse effects. So here you're talking about the relationship as it's reached that site. And then I think one of the aspects that's really key to IV versus oral here with CBD and really vitamin C and curcumin, when you look at it, it's the same applicable principle that is so important here, bioavailability, which is the fraction of the original administered drug. Here we're talking not about drug because these principles do not just apply to drugs, but also apply to natural therapies here, CBD, that arrives in systemic circulation and depends on the properties of the substance and the mode of administration. It comes down to some pharmacokinetic processes and principles that are great in the acronym LADME, also known as initialism. So LADME is involved in these 5 points: liberation, the release of drug from its dosage form; absorption, here we're thinking very aggressively in the oral dosing; distribution, so we assume that when something is taken orally, right, it's absorbed fully and it's distributed throughout the body once it's absorbed. Very few take into effect the metabolomics or metabolism of it, though again, Thomas Seyfried's talked about that, Naisha Winter's talked about that. I focused on that 2023, and of course multiomics in metabolomics is critical, and then of course excretion as a part of the process as well. All of this plays a role in the bioavailability and pharmacokinetics. And as this applies to CBD, when you look at the oral route, it's estimated that only 6%, several studies have shown this, only 6% of oral CBD is bioavailable. Now, a friend of mine that I met this past weekend over at Pico IV actually said that there's actually studies that show up to 18% is bioavailable. It doesn't matter if it's 6 or 18%. That is inadequate therapeutically. And so then when you look at the anti-cancer effects of CBD, you're looking at least at a floor of 10 milligrams per kilogram of oral dosing. And just for everybody to know, I had a patient in here today, was 172, I think he said his weight, and I calculated up his weight, converting that to kilograms. He needed to take 781 milligrams of CBD every day. I know many don't like the taste of it. The cost of it, both of those would make this prohibitive, but that's just the floor of its effect. This is why oral vitamin C does not achieve an anti-cancer effect. It just doesn't. This is why curcumin does not. The CBD effect applies here as well. It's a direct reflection of the medication absorption. So looking at the bioavailability gold standard. So what's the gold standards for optimizing bioavailability? Well, this article from 2015 said, well, it's all about the IV route. 100% of the drug arrives in circulation virtually instantly. Not virtually, it is. Giving the method a bioavailability of 100%. So counter that, 100%, 6%. This makes IV administration the gold standard regarding improving bioavailability. So again, this is going back to vitamin C. This was a slide I took from an old presentation I gave last year, looking at the same problems with vitamin C fundamentals. And it's talking about the issue related to pharmacokinetics and bioavailability. And this is a great quote from Linus Pauling that says, although physicians, as a part of their training, are taught that the dosage of a drug that is prescribed for the patient must be very carefully determined and controlled, they seem to have difficulty in remembering the same principle applies to the vitamins. So here, it's not just vitamins, it's to natural therapies as a whole. These are scientifically sound pharmacological principles. So if Joe, if you're listening, a good friend of mine, a pharmacist in Tennessee, these apply to all the natural therapies, and I know Joe would agree. And they apply to drugs as well. So the solution, well, just like the solution with curcumin, just like the solution with vitamin C, the solution with CBD, which is a phytocannabinoid that comes from either medical cannabis or hemp, it is IV delivery. It solves the bioavailability problem. And in turn, that is going to improve delivery. Honestly, it's going to solve the dosing problem. It's going to allow us to reduce the dose outside of things like the level of inflammation and tumor burden. It's going to improve both localized and systemic effects. It's going to improve the impact within the tumor microenvironment, and it's going to improve tumor burden and saturation, which we don't want to just reach the blood, right? We don't want to just reach the extracellular space. We don't want to just reach the edge of the tumor microenvironment. We don't want to just reach the edge of the solid tumor. We want to permeate every aspect of the tumor, the normal oxygen, the low oxygen, all aspects. Enough so that we can do that and impact the healthy cells, because we don't want to leave them out of this as well. So what's next? Well, so I tell all of our patients there are several principles that guide me here at Brio, where I'm medical director. It's hope, heal, teach, serve, and legacy. These are the principles that we follow that drive me. Hope is confidence in a tomorrow. Heal, that's what the word physician in Hebrew means. It's rophe, it literally means healer. Teacher, that's what doctor in Latin means. Serve, that's what we do, we serve. But here, we want to serve a legacy of healing for patients and for the future. So to do that, I talked about those principles here: innovation, elevation, empowerment. I want to add a few other to that and show you how IBCBD is going to really change the future of medicine, but it's not changed, it's here now. It improves the delivery issue. We can use this in combination with other therapies. I've already talked about in relationship to THC, you take that alone, but you can actually take it with improving chemotherapy, okay? In terms of improving the sensitivity and restoring sensitivity where it's been lost. It is multi-omic targeting. We've talked extensively here about metabolism, metabolomics. This is the study of metabolites and their effect on disease or healing. And of course, I like to talk about precision therapy stacking. That's about stacking these therapies to impact effect. Elevation, well, we're going to elevate through the delivery We're going to elevate the dose. We're going to elevate the delivery to the site of action. And we're going to elevate the impact as a result of that. Because if the dosing says at a bare minimum 10 milligrams per kilogram of oral dosing, or for that patient today, is 781 milligrams, people go, I can't, the taste of that, I can't tolerate that. Or the cost of it, they can't tolerate. So there, it doesn't matter if that 10 milligrams per kilogram does achieve all of that. That's again this floor. All of that is likely going to not deliver an impact. So of course there's no elevation, but this is going to elevate. Communication and collaboration, that's really what we're doing here. We're leading with the science. We're not making claims. The science makes those claims. We're just following the science. Now, what we want to do, and we're working towards that, super excited with our some of our friends there at Pico IV, Joe, Robert, Miles, and Dan. So we're going to advance the science, and we're going to build a legacy. We're going to collaborate to advance the science and teach the science. Get past the bias that is so prevalent in the cannabis industry. Took some IV vitamin C today, so it's turned my mouth into a cotton ball. We want to empower. Obviously, we want to empower patients. It's awesome to take care of 25 to 30 patients at a time. And that's what we do here at Brio-Medical, where I'm medical director. But if we teach doctors, empower doctors, now instead of helping 30 patients, you have 30 doctors helping 30 patients. This is how you empower on a macro level. And that's what collaboration and communication through following of the science allows us to do. And it's to build a legacy of teaching doctors, but the purpose is to heal patients. And the reason why teaching doctors is so important is because you heal more patients. And this is also too how we will pass on this knowledge, this awareness, these therapies, these strategies to future generations. From a doctor perspective, people will say, well, this is my proprietary information. Well, yeah, but who did you learn it from? Sure, you may have added something to it, but there's no shortage of people with cancer. The more doctors collaborate together, the bigger impact patients will have. So it's time for doctors to move beyond this idea of, holding things to their vest and start working together. And fortunately, there are a lot of doctors out there that are doing that. And so I'm super excited about where that's going to bring to patients in the future. An IV, this is going to occur through communication, collaboration to grow it, to build a legacy, not just currently, but for the future with many, many different doctors in today's day and hopefully in those beyond our day. Here's a link to Research Rabbit app. It is a storage app that I encourage you to go to. That's where I have just a few, actually quite a few studies there. But what's great about this, it can actually help you through the benefit of AI, do some deeper dives, and it's a lot of fun. So I encourage you to type this in and look this in, and you'll actually see what I'm looking at. And you can actually make comments and do all kinds of stuff. So I'll leave this up for just a second so you can type this down or write this down. I think AI is something we can use, using human intelligence to guide AI. And the future is human intelligence plus AI plus organoid intelligence. It helps us to actually template and actually model therapy before it's ever given to a particular patient. But it's a therapy that's to match the organoid that comes from the actual patient. Okay, we got a podcast where I sat down with John Catanzaro, the CEO of Neo7, and we talked about human intelligence, artificial intelligence, and organoid intelligence, as well as space medicine in the future, and it's super exciting. So thank you very much. That QR code will take you to links. I hope this has been informational and helpful, and so we're super excited to collaborate with the many people around the country, around the world. In this case, as it relates to Pico IV, it's just right across the border there in California. So shout out to the people over there, And this therapy is now on board at Brio-Medical, and we're super excited about the benefit it is providing to our patients. All right, well, thank you for suffering through that with me, post-migraine and all, and cotton mouth. I'm going to see some Q&A here, some questions. Will this be available for pediatric? Jessica, that's a great question. We don't treat pediatrics, but it should be. CBD is incredibly safe. There's studies that show 1,500 milligrams by mouth has no toxicity. And when you actually look at the dose in animal models of toxicity, it's upwards of 25,000 milligrams. But that toxicity, none of that has been shown to be life-affecting. So it's not causing mortality. So when you look at CBD, I think it's easy to say it's incredibly safe, even at really, really high doses, even toxic doses, which I know sounds kind of paradoxical. But you look at children with cancer, I think it's absolutely impactful there. You think about seizure disorders, very clearly that's impactful there already. I mean, if a child gets a concussion, would really help with recovery there, would help to prevent further traumatic brain injury. In terms of talking about autism, that I don't know. I don't study or do research in that field, but that would be an interesting place to look. What does upregulated mean? Scott, yes, I'm sorry. Sometimes I just kind of get in the weeds and I apologize, but that's important, I think, to show the science and the evidence behind it. Upregulated means if you have a receptor, so let's think of a receptor like a door. So if you have CBD, it binds to a receptor. So let's use CBD1 as an example. So you go up to a door and you knock on it, okay? The door is going to be open and there's going to be a process of transmission through that door. So instead of one door, upregulation would mean it's increased to 10 or 100 doors. So now there's more mechanisms, more pathways to follow through. Counter that is downregulation, which would be CBD, basically one door going to no doors, or 10 doors going to one door. It's just changing the mechanisms of how the signaling can be passed way through. Prostate cancer, Lewis, yes, CBD absolutely has benefit there. The research is very clear on that. Oral, but again, I think IV is the future, and that's why we brought that in. Yes, it has. Paul talking about has hemp-based CBD and cannabis proven to kill cancer cells in laboratory. That's just some of the few studies I've been showing here. And what you were seeing in some of those statements, some of those quotes that I have in those slides, it's their words describing the results of their studies in vitro, but in vivo animal models. This is even being shown in humans. This effect is being shown not just in a lab, but it's been shown in biological life, which is more important than any. Well, Joseph talking about, will this be available for kids with ALL up to 18 years, I guess, or up to 18 years? In many states in the United States, CBD is available. The key there is getting good quality, good dosing. A lot of patients will come into our office and they'll say, I'm already on CBD. And they'll show me their product, and I can't attest to the quality of the product, but what I find is the dose is woefully inadequate. So 5, 10, 20 milligrams. And again, the patient that I saw today, 171, 172, he needs 871 milligrams to hit the floor to maximize absorption and bioavailability as it relates to oral CBD. That's why bypassing that with IV, just as it does in vitamin C, really helps it to get its anti-cancer effect. Irene, can it be used along with vitamin C for ovarian cancer to help stay in remission? Well, first of all, congratulations for being in remission. What I tell all of our patients when they achieve no evidence of disease is now the real work begins, because now you have to work on things you can't see. And so congratulations to you, but vitamin C absolutely can be used in conjunction. That's what I call precision therapy stacking with CBD, IV CBD, absolutely. In fact, I do know somebody that gives the two exactly together. Now, I don't do that. We do it in very close proximity and sequence, but I do know that there is somebody that does that, Robert. So be interesting to talk more about that. Helen, thank you for being such a pioneer in integrative medicine. Um, so thank you so much, Helen. I mean, we have to keep innovating because it's about you. It's about Irene. It's about Joseph. It's about every patient that either comes to Brio or comes on the webinar or goes onto social media. When you look at the word cancer, there's no word I think that garners more fear than that word, cancer. And being a physician, when a person comes in that's diagnosed with cancer, my job is not to create more fear. There's plenty there. We need to turn around and give hope. Now, people would say, well, don't give false hope. And now I would agree with that. But the word hope literally just means confidence in and for a future. That's all it means. So our job is to give hope and to build that hope out. And the way we do that is we continue to innovate and we elevate, and that's how we empower ourselves, that's how we empower patients, and that's how we empower other doctors. Okay, so I have a client that's a child with brain cancer. Her daughter, who is 14, is off all medications and is using medical marijuana. My client would like some information to show the oncologist how to start Pico IV therapy. What would you recommend? Yeah, so what I recommend is go to picoiv.com. I think that's her website. Yeah, picoiv.com, and that's their website. And you can go there and find their information. They actually have, for the previous person talking about examples of success so far, lots of testimonials there, so check that out. Is your IV CBD hemp or cannabis sourced? Well, as it relates to Pico IV, I don't know. I'd have to ask Robert Miles about that. I do believe it's CBD sourced, hemp sourced, excuse me, because of the 2018 Farmers Act. I do think that's the case, but I'm not sure. But when you look at CBD coming from hemp or coming from cannabis, there it doesn't really necessarily matter because it is CBD. Yes, you do have to worry about some residual THC, but even when you look at THC that's commercially available, it's going to be less than 0.3%. But I don't have the specific answer to that, Helen. So, but I bet it's from hemp. But I'll work to get that for you. Will this work for stage 4 leiomyosarcoma? Well, Marva, as you know, leiomyosarcoma is a very aggressive form of uterine cancer. And the answer to cancer is not just one thing. I say the answer is immune system, but really it's the combination of therapies. It's the precision therapy stacking. It's the entourage effect that comes as a result of that. So this would be one of the therapies that would absolutely be useful as a precision therapy stacking mechanism. Would it work? You know, when you look at cancer, what I showed you in these slides is what the studies show are the pathways, the mechanisms of action. Then what it comes down to is making sure that we're targeting the tumor, we're understanding the mutations that are available, we're understanding what's driving this tumor. You have to bring everything on board. That's nutrition, that's supplements, that's the spirit, soul, body part, that's sometimes even repurposed medications, and that's the integrative strategies. It's bringing all that together. That's how you make cancer work. You precision therapy stack based on what the cancer is doing, the multiomics. That's what helps therapies to work. How do you run the IV as CBD is very thick? Oh, very good, Carolyn. Good observation. This is actually picomolar. So when we're talking about milligram, there's this can be a gram. There's milligrams. There's micrograms. There's nanograms. So everybody focuses on nanomolar, which is really, really small. Here they're taking it even 1,000-fold smaller, picomolar. So Miles, the person that helped to create this is taking a hydrophobic, you're correct, it's very thick, a hydrophobic chemical or compound that is CBD, and it's surrounding it with water. And you can do that by making it really small. So that in turn takes a hydrophobic or fat-loving or fat-requiring molecule, surrounds it by water, and puts it into solution. So it actually makes it, I wouldn't say it's like water, but it makes it very similar to water. It's actually put into normal saline. So that's how this process is able to work. It's through the picomolar reduction of its size and then taking it and surrounding it by water molecules. That's how it makes it not so thick, and that's how it makes it and puts it into aqueous solution, and that's how we deliver it IV. Is the hemp derived from U.S. sources? Yes. Do you feel CBD is triggering the TRP1 receptor? If so, you feel this is great for activating T cells? Yeah. So the TRPV1, I think it's, Dan, I think that when you look at the literature, I think we have to be very careful and not just think about one receptor and one compound stimulating that receptor. These receptors often work in concert. I mean, we know this with insulin. It cross binds insulin growth factor 1, and we know that the insulin receptor and insulin growth factor 1 can form a heterodimer. So we know that receptors of different types can work together. They can join together or just work together. So I think TRPV1, or transient receptor protein vanilloid type 1, it's very involved in calcium flux, calcium homeostasis, and that receptor does interact very specifically with CBD1 and 2. And when you look at the agonistic effect of all of that, I think absolutely it can activate T cells. Now, the question is, when you look at what environment and what cells we're talking about. You know, as I mentioned, one of the articles was talking about cannabinoids, particularly CBD, and how it was reducing the recruitment of immune cells to the tumor microenvironment, particularly tumor-associated macrophages, tumor-associated neutrophils, which we know play instrumental roles in how the cancer evades the immune system. These immune cells are recruited through chemotaxis to the tumor microenvironment, and this in turn, the cancer, through signaling, manipulates these cells, turns the immune system on the immune system, and then it starts to evade the immune system. So it's a very complex process, but also too, it blocks the myeloid-derived suppressor cells that are involved in that process. And so what happens then within the tumor microenvironments is you have a elimination of the immune suppression within that environment because you've reduced the recruitment. That's one aspect of what it does. And that's the beauty, and that's why I call it the Trinity effect, is it's going to actually, in some ways, counter immunosuppression, but in other ways, it's going to then stimulate T cells. So within that tumor microenvironment, there are going to be T regulator cells, sorry to get a little geeky here, and these T regulator cells are going to be involved in that immunosuppression within the tumor microenvironment. And what that's going to do is that's going to then downregulate the impact on activated T cells, CD8 cells, CD4 cells. So it's going to do all of that. But I think it's probably just not as simple as binding the TRPV. And what we're talking about there, these are nuclear receptors, so there could be non-genomic or non-nuclear receptor signaling that's involved here as well, as the hormone literature has shown us. So I don't think the complexity of that should shy or force us away from use here. I think it actually expands the potential impact of it and the amazing beauty of this created body. What about neurosarcoidosis? Will CBD help with symptom management there? Well, if you go back to the slides, and we're going to repost this, I think, next week on YouTube, so look for that. Sign up for our email because we will send out a notification of that. There's beyond just cancer, nausea, vomiting, pain, reduction of inflammation, headaches. I mean, the broad impact here is huge. So yes, it's going to help in symptom control well beyond just cancer. So there's the evidence, there's CBD. It's the future, it's innovation, elevation, and empowerment with IV CBD. And it's really just a replication of the work done in the past with vitamin C, curcumin, And this is now just continuing on with the medical use of CBD in the IV form. Super excited to see where the future is going here, both in a application to heal patients, but also in terms of research to advance the science. So I hope this has been enlightening as we work to innovate here at Brio-Medical and hopefully across the globe. So check out, of course, follow us on brio-medical.com. Also go to my personal brand website, that is drgoodyear.com. There you'll find the podcast, let me spit this out, Practicing with Dr. Nathan Goodyear, where just check out our three recent posts of podcasts we dropped on Paul Merrick. Very insightful, truly amazing pioneer. And we have a new podcast that will be dropping probably tomorrow, dealing with Scott Catanzaro, the the CEO of Neo7, also a true pioneer. That's going to be an interesting conversation. And then we also do just individual talks where I talk about just individual topics. So check those out there. And then Instagram is dr.goodyear, and you'll find us on all those, as well as every other social media site you can think of. You will find us there. But definitely brio-medical.com, drgoodyear.com, and then the Practicing with Dr. Nathan Goodyear podcast. Everybody have a great night and a great weekend, and let's enjoy the fall weather.